good feeling, yeah. I get a feeling that I never had before. No, I get a good feeling.
Hey folks, good to see you again. Today, the Health and Performance Center tip will be regarding knee injuries or knee pain or vulnerability for knee injuries. Anyone who has a daughter in soccer or a daughter in basketball knows about ACL injuries that happen just kind of out of the blue. Somebody goes up for a rebound, comes down, and all of a sudden they blow out their ACL, or somebody makes a cut in soccer or field hockey or lacrosse or whatever it is, and they just blow out their ACL. Well, that just doesn't happen. It's not because they had a weak ACL. It's from a specific movement pattern that we see all the time in females, also in males, but females are a little bit more susceptible to it, which is this knee in position right here. What this is called internal rotation of the femur. And as you see, if my leg's all set up and where it needs to be, I'm a little bit externally rotated, okay? When I'm in a bad position or a vulnerable position, I'm in this knee internally rotated position or knee valgus position. Any type of force coming from right here, if somebody rolls into me or if somebody hits me on this leg, I am just absolutely going to shred the inside part of my knee. So that's a traumatic injury. However, if I'm doing a lot of squats in this position, if I'm running and landing in this position over and over again, is going to severely stress the inside part of my knee as well as right underneath the kneecap. So the main thing is gosh, if I'm moving in this position, why is that the case? Okay, a lot of times there's a disconnect between the core and the hip, which is what needs to be identified and reestablished, so that anytime I do my squats, I'm in this position. So as parents, you can use this as a screening type tool. If you see your daughter, if you see your son moving in this position, they're talking about knee pain, they probably need to get evaluated if they are that scholarship type athlete, so that that vulnerable injury or that devastating injury doesn't happen. On the other hand, gosh, performance. They only get 4 years in high school. They need to be using those to the most so that most of the colleges can see what's going on. They can get those scholarship opportunities. That knee position, knee pain is something that we see all the time in the clinic, and it's very easily treatable. So keep that in mind.